What is up, guys? Welcome back to the channel. My name is Ariel, and for those of you that don't know who I am, I'm a registered dietitian in the state of Florida. And lately, I've been reacting to the fitness industry, specifically their daily diets. And on these videos, I get comments like, who is this guy and what qualifications does he have to speak about nutrition? I'll tell you. So I got my bachelor's and master's degree in nutrition and dietetics, and I did an 8-month internship where I had to pay to work for free at 8 different locations, ranging from inpatient hospitals, outpatient, at cancer institutes, at a nursing home, and I also worked in elementary schools teaching children about nutrition. With that being said, a lot of people have no idea what dietitians do, which is fair because most of the time it's not really explained. And we often get confused for nutritionists, and people don't really know the difference between a dietitian and their Joe Schmo person speaking about nutrition on social media. So in dietetics, we implement what's called medical nutrition therapy. So it's a specific diet for different disease states like diabetes, for people with congestive heart failure, with people with diverticulitis. Different diseases call for different diets. And that's where we come in where we give the education and depending on what setting we are. If we're an inpatient dietitian, which means that we see patients while they're hospitalized, it's a lot different than outpatient when people come and they usually receive education usually on weight management or for diabetes. So usually I'm an inpatient dietitian, so then I'll go see the patient specifically how they're eating. Usually you don't want to lose a lot of weight during your hospital stay because that could exacerbate different medical conditions, and we don't want that. So if a patient is not eating that much, we provide supplements, which we prescribe usually Ensure if they don't have diabetes or renal issues. If they do have diabetes, they are given a supplement called Glucerna or Boost Glucose Control. If they have renal issues, we give them a supplement called Nepro, which is low in electrolytes like potassium, sodium, phosphorus, since they cause a lot of strain on the kidneys. And if they have dysphagia, which is trouble swallowing, they're seen by a speech language pathologist, and according to what they say, we alter the diet, specifically the texture of the diet. So we usually do a mince and moist, we do a pureed diet if it's really bad, and they range by different levels. If a patient can't eat at all and they have a lot of difficulty swallowing, then we go to tube feeding, which is where dietitians play a huge part. And again, there's different tube feeding. You could get a nasogastric tube, which is a tube that goes through your nose. So this is if you have a functional stomach and for short-term feeds. Or we go with what's called a nasal duodenal tube or a nasal jejunal tube, which is from the nose directly to the duodenum or the jejunum. And this is if they have high aspiration risk, which aspiration means when you're eating food and it goes to the lungs, which you don't want because that will cause pneumonia. Or they'll get the tube surgically inserted into them, which is called a percutaneous endoscopic gastrostomy. Or we just say PEG because that was very long. So this is more for long-term feeding and if you have a functional stomach. If the person has poor gastric motility and for long-term and high risk of aspiration, then we do what's called a J-tube, which is a jejunal tube. And if the person's stomach is not functioning well or there's an obstruction, like a small bowel obstruction, then we'll usually go with what's called TPN, which is called total parental nutrition. And not that your parents are giving you nutrition, that means nutrition through the veins, which is the last case resort that we want because it's the most unnatural and there's a high likelihood of infection. So this is like worst case scenario. So if they have a central line, which is commonly known as a PICC line, then we give total parental nutrition, which will be able to give a patient's total calorie needs. Or if they don't have a central line, we do what's called peripheral parental nutrition, which is through the veins of the peripheral extremities. And dietitians, we also provide education when someone is recently diagnosed with a disease that they don't know how to eat. For example, if a patient gets an AKI, also known as an acute kidney injury, dietitians, we come in and we say, hey, this is how you're going to be eating from now on, so you won't get any extra complications. Or diverticulitis, which is the inflammation of their diverticulum, the dietitian comes in and we explain how to adhere to a low fiber diet. And lastly, dietitians, we diagnose malnutrition. So we do this through a variety of ways. One is that we go in and we visually look at them and we do what's called a nutrition focused physical exam. So here I'm looking for muscle wasting. You'll see it like through the clavicles, which is called like pectoral muscle wasting, or the temples. When someone is malnourished, you'll see these sunken in temples, and also you'll see a lot of loss of fat, specifically in the buccal area, which is their cheeks, or the orbitals. They'll have these sunken raccoon eyes. And you'll see it through the triceps. They'll have a lot of fat loss that will look like twigs, or you can see it through their legs when they look like sticks. Various ways that we can test for malnutrition. Also, we use a dynamometer, which is that thing that you grip to see how strong your grip strength is. We commonly use that to diagnose malnutrition. And also, we calculate their weight loss. So if they go over a certain percentage of weight loss in 1, 3, 6, 1 year, that is another metric. And lastly, in the hospital, every patient's food that they eat is documented, like what percentage, like 50%, 75%. So if we see that consistently over a period of time that they're eating very low, that's another metric to diagnose malnutrition. So hopefully this helps shed some light on what dietitians do. And if you learned something new, make sure to subscribe to the channel. I'm a registered dietitian and I love talking about nutrition. See you guys in the next video.